Good evening, good afternoon, and good morning. This is the 1667th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Rajeshwari Rapta. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, the international session in English, and from 9:30 to 10:30, local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that you can share it and you can subscribe it without paying any money, and you can share it with your friends and homeopathy lovers too. The purpose of this forum is to take homeopathy to every home around the world. And whenever there is a threat from any other part, we used to react in a positive way to protect homeopathy. That's the purpose of the International Forum for Promoting Homeopathy. And I would like to invite the guest of the day, introduce the guest of the day. As you all know, it is none other than Dr. Rajeshwari Rapta. And doctor has multiple degrees in hermetic. First, she has completed a DHMS, then MBA in hospital and healthcare administration, then certified weight loss coach, and a diploma in psychology and counseling, and in BLS and ACLS, certified European guidelines. And she was the former principal, hospital administration, and ex-professor, HOD, anatomy, and MUHS nursing. And her expertise include homeopathy consultation, academics, management, counseling, hospital administration, teaching, training, and internal auditing of hospital. She is the founder of the Art of Healing Gurukul. And though her project, Kar Homeopathy, she is on a mission to skill India on awareness of medical emergency conditions, CPR, first aid, and role of homeopathy. Scientific and medical writing was a part of her work, but she had started feeding her flair for contemporary writing recently and contributed articles and poems to various anthologies of English to publish houses. She has awarded the ILPH Adventurous Writer Award in 2020, the Best Teacher Award in 2020, and the Bharat Shiksha Gurukul Award in 2011. She is an avid driver, podcaster, a YouTuber, loves singing and cooking. That's all about Dr. Rajeshwari Rapta. And today, Doctor will be talking about the physician heal thyself. As you all know, the doctor has presented so many sessions in both our Hindi as well as in English session. But today, entirely different, physician heal thyself. So we proudly welcome you to the session, madam.
Thank you, Dr. Danish sir, for such a elaborate introduction. Today's topic is physician heal thyself. So let me share the slides.
Okay, it's fine.
Can you see the slides, sir?
Yes, it's fine. You can make it big.
Yeah.
Yes.
So here, it's about physician heal thyself. You might have heard this proverb. It's actually a proverb. Physician heal thyself. So it was also quoted by our Mahatma Gandhiji, that the physician heal thyself is more true in matters of religious than mundane. So it is religious. It is our dharma to be healing ourselves as a human being, not only as physicians but human being. We should be healing ourselves, and then only we will be able to take care of others. Okay? So that is the motto behind it, that physician heal thyself is a general term usually, especially which is used for people who advise others, for betterment or something like that. But they are not self-healing. They are not taking care of themselves. So it is, as a general term, it is quoted as a proverb or a saying. So that's what we are going to discuss, that how it is relevant with the healthcare facility, how it is relevant with the healthcare professionals. So that is what we are going to discuss today. So first, physician heal thyself. It is a proverb we all know now. It is also in Latin. It was called as medis cura de ipsum. And this origin of this proverb usually, it appears in the Bible, in the Luke 4:23, and it has been also used in the literature since 6th century. So in many literatures and many stories, this proverb is usually comes, and relevantly it means that the person who advises, who treats, and it is quoted against that person. So the meaning is doctors should care for themselves when it comes to the term, when it comes in relation to the healthcare professionals or doctors or the healers. It means doctors should take care for themselves so that they can better care for their patients. And it also means that people should take care of their own problems instead of just fixing others' problems. So first, charity begins at home. So first start with ourselves, and then we will be able to take care of others. Now, application of this, how it is applicable. Doctors are often they cite the proverb as justification for treating themselves sometimes, but it doesn't mean that we have to treat ourselves with medicines. Okay, it is like healing thyself doesn't mean treating yourself, rather living in a way that keeps you well, or in sound senses, or in sound health, physical health. So this proverb can also be applied to the idea that charity begins at home. Now, I take the first aid homeopathy courses and CPR as a CSR venture, you can say, or it's a national awareness program. So while I teach CPR, the first thing which we say is to see the scene safety. Okay. So before conducting the CPR, the victim who is lying on the place, we just go and check for the scene safety. So what we do first, we are see that we are safe to enter the scene. So first we are taking care of ourselves, isn't it? So first checking the scene safety for our own safety, and then saving the victim. So here also first care begins with ourselves, isn't it? So that is the meaning of this proverb. Physician heal thyself. Okay, physician heal thyself. Now coming to the aphorism 83. In aphorism 83 in the Organ of Medicine, Dr. Hahnemann or Master, he said that the individualization examination of the case of the disease, for which I shall only give in this place general directions, of which the practitioner will bear in mind only what is applicable for each individual case, demands of the physician nothing but freedom from prejudice and sound senses. So attention in observing and fidelity in tracing the picture of the disease. So while while during the case taking or case receiving, whatever we call it as, in that first, the sound senses of the physician is utmost essential. If a physician is in his sound senses, then only he'll be able to take the totality of the case. We'll be able to observe and understand the case. So here also, Dr. Hahnemann says that physician should, take care of himself, should be in sound health or sound senses. So it is that much importance that physician should be in sound senses so that he'll be able to successfully take the case and treat the case properly. Now, coming to the causes of the uh, burnout or different the illnesses of the physician, or whatever causes of the physician burnout. before discussing the causes of the physician burnout, let us discuss what is this burnout. What do you mean by burnout? So anything which leads to the patient's leads to the physician's ill health, okay, and leading to the tiredness, excessive tiredness, fatigue, without any reason, not remembering things. All these lead to the burnout of the patient. There are various other causes as well, and there are symptoms as well. Now, when coming to a doctor being a patient, you'll always see that the doctors make lousy patients. And the Doctors Health Advisory in US, they made a survey and estimated that 40 to 50% of the doctors, they do not have their own GP. They don't have their own any person who takes care of themselves, or while in case of illness, whom to go and ask. So almost 40 to 50% of doctors don't have their own GP, and these doctors failing to look after themselves could almost be considered negligent, because there is a clear evidence that doctors' health contributes to the quality of the clinical care they provide. So that much importance is physicians' health itself. Doctors also frequently display dysfunctional sickness or sickness behavior and work while unwell, so that as they may go on to the work even if they are sick, so that other things are taken care of. Like they may burden the colleagues, so that's why also they may go to the work and do, or other family responsibility, whatever the cause, but they don't neglect the work and they go in spite of the ill health. So that's what makes the doctors lousy patients. Also, another thing is that they have a lot of knowledge and they think that they can treat themselves. That is one thing. So many times we see that we have some minor complaints, we just try to take care of ourselves by taking some medicines by ourselves. And the minor things, if we don't realize that this may go into a major thing, and just time passes and then it can go on to form a major sickness as well. So it's very important to understand it at the initial part itself. Now, causes of physician burnout starts from the student life, when the medical student is studying. The educational cost, medical school, excessive workload when the person goes to the internship and then further goes working as a physician. There's a lot of exhaustion due to the work maybe, and administrative tasks are given to the physicians, work-life balance. There are bureaucratic tasks as well, depending on the position the physician is working. There is a growing patient demand. Also, again, depending on where the person is working. Sometimes there can be lack of professional respect, which can also affect the mental health. There is no enough time for the patients because there is a rising number of patients. Sometimes there is a reduced patient satisfaction. The feedback can also affect the physician's health. There is an anxiety. There is a decreased personal achievement. The person may feel that personal professional achievement, he is not able to achieve as much as he is expecting. Then the specific type of job he is into. Okay, the specific job or specialized field he is working into. And also sometimes there is a disrespectful behavior from the patients. Also nowadays you see that electronic health records, the WOS, the digital, electronic health records also play important things. Many are not updated to the working of this EHRs. So that is also one of the factor where the physician may have some problems regarding this. They don't have a life. Totally they are engrossed into the professional life and they don't have a life, personal life you can say, or where they can relax and rejuvenate. Then the healthcare industry also plays a very important role, where they may be burdened, and then it leads to the physician burnout. There can be heightened risk of malpractices. There can be increased, there should be increased compensation, which sometimes is not there. There can be inflated physician recruitment costs. Now, this is all at the organizational level. There can be insomnia, sleep disorders, which may be because of the physician burnout, or it is vice versa. So, and eroding physician autonomy and independence. Many times when a physician is working in a good position and in the top position, and he doesn't have the required autonomy and independence for the decision making or other responsibilities, then also it can cause a physician burnout. So these are some of the causes of burnout. And the World Health Organization, it defines burnout as a syndrome. Collectively, many symptoms coming together to make the physician go into a chronic syndrome, where there is an unmanageable workplace stress. It is not only related with the physician, but also any person who is working in some industry. But here, as we are talking about the physicians and the doctors, it is related to the physician burnout. So the criteria for this burnout, it includes energy depletion, total fatigue. There can be very low energy levels, feeling very exhausted, mental distance. The physician may feel very negative about the job, feels detached about the job, and there is a reduced professional efficacy. So the physician may feel that he is ineffective, or like the physician has accomplished very little, and doesn't feel like working also. Other symptoms are like there are cognitive symptoms, concentrating problem, okay, and remembering or thinking clearly. Sometimes there is emotional upsets, feeling helpless, hopeless, or discouraged. May have mood swings. There can be behavioral symptoms. Then the person may isolate themselves, act distant, and then withdrawing. There can be physical symptoms like headaches, nausea, aches, low libido. All these symptoms may be there. So, yesterday as we were discussing, and I have discussed it in various other workshops also, we conduct a Vihasa workshop in especially medical colleges and hospitals, which deals with the healthcare professionals. They have their own problems. When you go to the hospitals and other healthcare institutes, where we deal with the staff, and while dealing with the staff, we see that they have their unique problems, which usually don't come out because we are the healers, we don't expect to talk about our problems. Okay. Yesterday also, when I took this webinar, uh, it was said that we are healers, we are doctors. So of course, it is a natural thing that we have to deal with all these things, and we should be strong enough. But what in case some of the healthcare professionals who are not able to deal with all these things because of the reasons which I just talked about? So there can be all these reasons which may lead to the burnout of the physician, and it is a problem in the healthcare industry. Okay. So we as homeopaths, if you are having a private practice, you may be having your unique problems. If you are working in a medical college or hospital, teaching hospital, or you are working in some other healthcare institute, the different problems are according to the place where you're working, according to the senior responsibilities which you are having. So depending on those, you have the unique problems and you have to deal with it, and you have to take care that it doesn't affect your mental and physical health. So these are the symptoms, and that is how the burnout was defined by the World Health Organization, and why it is important for the physician to take care of the self. So there is a Maslach burnout inventory. This is a scaling tool, And it is for the medical professionals, which is called as MBI HSS MP, and it is a tool for measuring the burnout. The Maslach burnout inventory, it is a survey that assesses the burnout in the workplace, and it is considered as an industry standard, and it is also used to study the burnout in large groups of people. It can be used as an individual tool also, and also for studying the large groups. So it can be used in the organizations where a large number of physicians, healthcare professionals are working, and to assess the rating that how much the person is into burnout, what are the symptoms. So it is a 22 item survey, and it covers around 3 areas, that is the emotional exhaustion, the depersonalization, and low sense of personal accomplishment. So based on these 3 areas, the 22 item survey is there. And there is each subscale. Each subscale, it includes multiple questions with a frequency rating, like never, or a few times a year, or in the month, few times in a month, or few times in a week, or almost every day. So these symptoms are classified in that way. And the person is expected to tick mark according to the choices. And then the rating is done. And then whatever the care which has to be designed for that physician or healthcare professional is done. So what does this MBI measure? It measures the emotional exhaustion, how much worn out, how much depleted or fatigue you feel. Depersonalization, like how cynical, detached, or irritable you feel about your job. Then the sense of personal accomplishment, how much you feel accomplished or productive at your work. All these things are measured and graded. And then depending on that, the MBI is used to assess the burnout in the individuals or in the groups. You can procure it from the website called as Mind Garden. It is available. Suppose a healthcare organization decides to conduct a survey of the employees, the medical colleges or the hospitals, or individually also, if you want to test your own burnout scale, you can just go to Mind Garden website and then download this, and online you can conduct your own rating. So it can be used to study the burnout in variety of occupations, not only medical professionals, but but for medical professional, this is a different survey tool. So it can also identify the patterns of the burnout. Who developed this MBI scale? The Christina Maslach and Susan E. Jackson developed this original version of the MBI. Now, as we are all homeopaths, we know that we give the care or we give the treatment according to the constitutions. We study, we take the totality of the case. We understand the patient according to their mental constitution, to the physical constitution, the symptoms, mind symptoms, general symptoms, physical symptoms, right? So depending on the personality type, it is classified that the diseases also occur according to their personality types. So let us discuss about what are the different personality types and how the different diseases occur depending on the personalities. So here you find that there are the 4 major personality types, and these 4 major personality types have further 4 subcategories. So here analyst is the first group, which has 4 subtypes, that is architect, logician, commander, and debater. So you'll find that the architect was imaginable, strategic thinkers. They have a plan for everything. The logician is one who are like innovative inventors with unquestionable, unquenchable thirst for knowledge. Then there is the commander. The commander is bold, imaginative, strong-willed leaders. Always find a way or making one way for others. Then there is the debater. The debater, you find that is smart and those are thinkers, curious thinkers, and they cannot resist an intellectual challenge. So that is the debater. This is the first personality type, that is analyst. Second is diplomats. Again, diplomats has further subcategories. Then advocate, mediator, protagonist, and campaign. Advocate is quiet and mystical, and yet very inspiring and tireless idealists. Their ideology, they have ideologies, and they are quiet and mystical. Then is the mediator. Mediator is a poetic person, kind and altruistic person, always eager to help for a good cause. Then there is a protagonist, who is charismatic and inspiring leader, able to mesmerize the listeners by the whatever speeches they give. Then there is the campaigner. Campaigner is very enthusiastic person, creative, sociable, free spirits, who can always have a reason to smile. So such wonderful personalities you can see. Okay, and all these wonderful characteristics come with a price. You know, so that price is what they pay for. That is the disorders which come out of their characteristics. So then there is the sentinels. The sentinels are again subgrouped into four: the logistician, defender, executive, and counsel. Logisticians, they are practical and fact-minded individuals whose reliability cannot be doubted. And then there is the defender, very dedicated and warm protectors. Always they are leading, ready to defend the loved ones. Then there are the executives. They are excellent administrators, unsurpassed at managing things or people. And then there is the counsel, who is extraordinary caring, social, and popular people, always eager to help. Then the final one is the explorers, who again have the four subcategories: virtuoso, who are very bold, practical experimenters. They are masters of all kinds of tools. Then there is the adventurer. Adventurer is flexible, and they are charming artists who always are ready to explore and experience something new. Then there is the entrepreneur. The entrepreneur is smart, energetic, very perceptive people who truly enjoy living on the edge. And then there's the entertainer. They are spontaneous, energetic, enthusiastic people, and life is never boring around such people. So these are the four main personality types under which the subgroups are there. Now, why it is important that we understand these categories of personalities? And then also, again, A, B, C, D type of personalities according to Myers-Briggs, classification, which we are going to see. Now, coming to why the burnout is it really a serious problem? Most of the people, clinicians, if you find, they will say that, yes, it's a problem because they are experiencing it when they are working in an organization. If you sit in a closed room and you are doing things, then maybe it doesn't matter. But when there is a social interaction, when there are environmental factors, of course, it becomes a serious problem. There can be pressure from the peers, there can be pressure from the administration, there can be so many things. And ultimately, depending on the personality type, the person may take it or may not take it, and ultimately burnout becomes a serious problem. So clinically, the clinical leaders say that 69% it's a serious problem. Executives say that no, it's lesser than that. So that is the opinion of the clinical leaders and the executives. So it's even if it is a 60% or lesser than that, still it's a problem. Is a problem. Even if it affects around 6 persons among 10, or even if it affects 7 persons out of 10, it is a problem. It has to be addressed. Now, why INFP is called as a healer? So we are all healers. Those people who are working in the healthcare sector, or those who are no even priests, you can say, or those carers, who work as assistants or attendants to the patients, the nurses. Okay, all these people who are taking care of somebody is a healer. So coming to this, why INFP, that is intuitive feeling personality. Okay. Why they are called as healers? Because of their empathy, because of their skills to take care of people. They have a passionate idealism. All these lead to make them the healers. So coming to the burnout, whenever there is a healing mechanism in a person, the person tries to catch the vibes in that place. Now imagine yourself as a homeopathic physician. When we see that a patient enters the door, we catch the vibe of the patient. We observe, we are the observant person. So we are observing the patient right from the doorstep when he's entering the clinic premises. And as he sits down, does various kinds of activities, or his everything we observe. And while we are observing, we are catching the vibes. And maybe depending on your condition, maybe one per patient, two patient, or 100 patients. When you are catching vibes of so many people, ultimately it affects your health. Okay, so that is what I mean to say, that healers, INFP, why they're called as healers? We are all INFP because we have chosen this healing profession. So it leads ultimately into a compassion fatigue, where we are associated with empathy, where we are associated with healing, where we are associated with observing the patient and understanding the vibes of the patient. Without him speaking even a word, we understand almost 20% of things which is happening with him as a homeopathic physician, right? So that's what leads to compassion fatigue. Now, compassion fatigue is part of the burnout. It is a part of the burnout. So this is not something which is working on the physical level, but at the mental level, when we start feeling that compassion fatigue, one day it affects the physical health as well. So it is surely to give you the results in your reports, in your blood works. So it's very essential to understand the initial part when you're going into the compassion fatigue. And there are healing techniques of compassion fatigue, like at the emotional level, spending time with the loved ones, using humor, laughing, okay, and articulating affirmations, positive affirmations. Whenever negative thoughts come, converting into positive, okay, and practicing self-reflection, understanding your own strengths, weaknesses, and healing yourself. Okay. So healing, there are many healing techniques like mindfulness, understanding the cognitive signs of negative thinking pattern. So there are two techniques. One is mindfulness and one is the heartfulness, which usually healers should practice. Mindfulness makes you stay in the present, focus on the things, and helps in understanding your thoughts and converting them into the positive affirmations. Like suppose we are thinking about a patient, like a client has relapsed. You may think that my therapy was not successful, but this thought can be converted into a positive thought. Like, although they have relapsed, I could not have predicted that. So I should focus on what I can control and on all the good I should manage to achieve beforehand. So converting the negative thoughts into positive thoughts, which can be achievable and which should be achievable. So understanding the negative thinking pattern and making it positive. That is mindfulness. While heartfulness is the thing that you concentrate on the intuitive part of your heart, which helps in decision making, which helps in making the things flow softly, and understand your heart's intuitive vibes. There's a difference there. Now coming to the healers versus compassion fatigue. We should understand that helpers are successful. It can be a great reward. But when a healer gets trained or when they fail, helpers may be the next dominoes who follow the victim suffering themselves. This has happened already during the COVID times. In the COVID pandemic, how distressed were the physicians themselves? Even though we can't avoid the fact that burnout is a real thing. Now, consequences of this burnout, what happens? It can lead to a toxic work environment. It can lead to increased medical errors. It can lead to decreased physician productivity. It can lead to decreased access for patient care. There can be increased economic losses due to attrition. Now, this is for those physicians who are working in hospitals and organizations. It increases the healthcare costs because of all these things, because of the medical errors or because of the increased economic losses or decreased access for patient care. So increases the healthcare costs, increased rates of physician attrition and premature retirements. People will take the premature retirement, physicians will take because of this burnout, because they are not able to take all the pressure and all this kind of fatigue. Poor quality of patient care and satisfaction. So all these are the consequences of the physician burnout. Now, as in India, we have increasing number of the students who are passing out from the medical colleges. Maybe you won't understand, we won't understand the real burnout which is happening in the industry, healthcare industry, but surely it will be evident soon or later. And then taking care of it will be very difficult. To understand the problems in the initial stage is very important so that we can avoid a major disaster. Now, what types of compensations or benefits are needed to attract and retain the physicians? So you'll be surprised to know all these factors because we usually don't delve into all these kind of things. As me being into the administrative field for a long time, working in hospitals was also one of the part of my experience. So I see all these things at that administrative level. So higher compensation, 74%. Okay, people agree with it. When the survey was conducted on around 1,179 physicians, this was the result of it. Many of them agreed that 74% agreed that higher compensation should be given. Okay, for the physicians who are working. Less administrative burden because apart from the clinical work, there is a lot of administrative work also which they have to, and it's a great deal. So 73% say that administrative burden should be lessened. There should be flexible work schedules. We already know certain cases which recently happened in the and very were in the news in the last few months about the working schedules of the doctors in hospitals and the interns in the hospitals. So 61% people say that there will be flexible work schedules. More manageable caseload. Okay, so the real caseload or the false caseload, whatever we say, but the doctors are forced to work, taking more patients. And care team support. There should be a support team for the physicians. 50% say that. Flexible contracts, then greater autonomy to take the decisions. The doctors are not able to take the decisions. In many cases, like procurement of things or dealing with the cases, major decisions are taken by the administrative people who have the power. There should be better promotions and advancements. There should be child care support in case of ladies who are working, lady doctors, child care support, and mentorship programs. Now, how many hospitals or teaching hospitals have these kind of mentorship programs for the doctors? not updating your clinical knowledge, but related to the other things. So mentorship programs are very important. Mental health and wellness programs. How many of the hospitals and teaching hospitals or colleges have psychological counselors who take care of the doctors who are working? And then better family planning benefits, and then other things are also there. So all these contribute, to attract better and retain physicians. Otherwise, the physicians leave, the doctors leave, and then there will be acute shortage of physicians in short time in India as well. So this survey was done in the US, but it is applicable commonly for Indian doctors as well. So healers, as it is said, healers are not perfect. They are actually far from it. And healers are those people who have stared into the face of pain and suffering and found themselves staring right back. And they create themselves through all of the adversity. And in this process, inspire others to do the same. And these healers do not necessarily have to heal others. They heal themselves and inspire others to do the exact same. So that is healers. But now again, considering the personality types, there is one kind of personality which is called as self-healing personality. Rest of the personalities, they have their own specific patterns of behaviors which are associated with the specific types of health issues. Now, this wide range of behavior patterns are associated with varying health issues, and this actually was first found out by Howard Friedman and Both Kevley, and they discovered that these are called as disease-prone personalities. So the disease-prone personality involves negative emotions like depression, hostility, irritability, and anxiety. And then they can go on with the negative emotions, and then there are a number of other diseases like asthma, arthritis, coronary artery diseases, headaches, and ulcers. Such kind of all these things can be affected. And then there's the self-healing personality, which I was discussing right now. And this self-healing personality, it is a set of behavior patterns that help in resisting people to get any kind of disease. So those doctors, in spite of, taking all the negative emotions or taking all the vibes for the patient, still remain healthy. So that it can contribute to around, 40 to 50% of doctors. But what about the rest of the 40 to 50% of doctors, physicians who are not able to take that? Then either they may retire, or they may commit suicide, or, do other things, out of the mental and physical health conditions. So this self-healing personality, it's a set of behavior patterns that help in resisting people from getting any kind of disease. And Friedman has extensively written about the self-healing personality in a book which is called as Self-Healing Personality, Why Some People Achieve Health while Others Succumb to Illnesses. So that's about the self-healing personality. There is a disease-prone personality, and then there's the self-healing personality as well. Okay. Now, one of the main cause here for all these kind of diseases and all is developing the diseases is hardiness. A person who is very rigid and hardy, that acts as a buffer to stressful life events and can cause damaging effects on the health. So this kind of hardiness, it comprises of three components. One is commitment, control, and challenge. And all these factors further lead to the disease conditions. So commitment is about engagement in the life and viewing life as a meaningful and purposeful. Then there is control. Control is the influence of the events in life. Then challenge is orientation towards viewing the change and adapting as natural and rewarding and associated with the cognitive flexibility and ambiguity tolerance. But now, when you come across all this as in a limiting factor, then it's okay. But if it crosses the boundaries, then the person can get prone to disease conditions. So not to be high on hardiness, that can again lead to threatening conditions. Now, as I said that there are the 4 personality disorders, personality types, A, B, C, D. These personality types also have their own health condition. They can develop the different types of conditions like coronary artery diseases. Okay, anxiety disorders are found in the personality A type, and then they need that relaxation techniques, mindfulness, meditation, deep breathing, progressive muscle relaxation. Sorry. Time management is also one of the thing. Okay, setting realistic goals and prioritizing the tasks to reduce the pressure. Physical activity, regular exercise, because these people are very hyper. They want to do things in a hurry, they fast, and they also have the pressure on themselves and create pressure on others. So regular exercise to manage the stress and improve the overall well-being. Like we see next Swamika patients, right? So important considerations here is individual variations. And this kind of personality types, they also provide a framework. And each person within a type will have unique needs and challenges. Then there is a personality B type. They also have their conditions. It is said that the people who try to suppress their emotional needs, anger, and the different desires and needs, these people are very responsible as well, and these tend to develop breast cancer. So these are into personality type B. So you'll find such things, and it was the survey was conducted and research was done on this, and it was found that these type of personality B who tend to suppress the emotional needs, take over a lot of responsibility, and then they suffer from this breast cancer, especially taken in a survey of women in US, and then it was decided that the results came out that these people suffer from the breast disease, breast cancer. So according to these personality types, we have the different health conditions. So I'm not going to go deep into that. Now, another thing is inner child trauma. When I was watching the last video where I just left abruptly because of some personal reasons, and later I watched the discussion which happened in the later part of that. A doctor, I think she was discussing about inner child trauma. And most of these things happen because of the inner child trauma, she was telling. So yes, inner child trauma is also one thing. Our mental beliefs, our conditioning, our inner child traumas can also lead to the burnout, because these are the pre-conditioning of our mind, which may lead to judgmental beliefs and can affect our mental health as well as physical health. So inner child traumas like feeling bumped, living with persistent fears, hating being lonely, and interdependent relationships forming, attracting emotionally unavailable people. That is the inner child trauma. And that can lead to, in the future age, that can lead to so many problems, and which can interfere with your work as well, work-life balance. Then there is confidence trauma is also like afraid of getting hurt, low self-esteem, always finding ways not to trust others, feeling unsafe, yearning for external confirmation, usually attracting people with feelings of unsafety. Then there is another type of trauma called as guilt trauma, feeling pity or bad, and does not want to ask for things, uses guilt to handle the things, attracting people that make other people feel guilty. This is a guilt trauma. Then neglect trauma is there, where usually in the childhood, the person might be neglected. So having low self-esteem, gets angry easily, tries to say no, suppresses the emotions, then afraid not to become sensitive, also usually attracts people showing no appreciation or making the child feel invisible. So all these types of trauma are included in the inner child trauma, and these can reflect in their work life, personal life balance. So this can also affect. So coming to all the solutions to these problems, whenever there is a problem, there should be a solution. Now, who can understand better than a homeopath, right? So solutions at the functional psych level and organic disease level. Now, here, as I mean to say that we need to take care of ourselves, by what means we are going to take care of ourselves as physicians? Finding a mentor or a guru is very important in life. Either you have a spiritual guru or a guru who is a professional guru, so it's very important to have a mentor or guru so that we get a reflection of what we are doing in life and what's happening in our life. Otherwise, there is also self-healing techniques or self-understanding techniques like mindfulness and heartfulness, where we can assess ourselves and, get better in life. Then there is the inner engineering, like understanding our life, whatever happening in our life, and converting it into a better thing by understanding or getting the SWOT analysis done by ourselves, sitting in deep meditation. And then visualizing. Visualization is also one of the things where we visualize our deep traumas and try to understand why this has happened, heal ourselves, and to visualize a better tomorrow or better future. So visualization is also one technique. Then is journaling. Journaling is a very good habit, especially when we were children, we were asked to write the journals. But as we grew into adults, many of them have forgotten it and we don't do the journaling. Sorry. So it is very important, the journaling. Even I do the journaling. Getting up in the morning, sparing 5 to 10 minutes for ourselves, writing what we are supposed to do, paying the gratitude. There are different techniques of journaling. Journaling doesn't simply mean that we are writing a diary of our life events. So journaling has different techniques, and one has to learn those techniques to make a better tomorrow for ourselves. Then developing hobbies. Developing hobbies doesn't mean that we pursue a hobby one day and then after 1 month or 2 months, we again go for that. Any hobby should be consistent and then something good resulting out of that hobby. Okay, so that good is that healing ourselves, like singing. It may be singing, it may be going for adventure sports, or it can be going into nature, trials, trekking, something which gives healing to you. Spending time with friends and your loved ones. Then spirituality is also one thing which helps in healing. Understanding the psychological aspect, the philosophies and spirituality is very important. Learning the NLP techniques, neuro-linguistic programming, where we can heal ourselves. Psychotherapy, counseling. If you are in need, go for a psychotherapy, go for a counseling. It's very important that whenever you are in stress or in a condition where you are not able to help yourself, it is very good that you seek help. Finding a purpose in life. Finding a purpose in life, many times it happens that we are involved so much in the daily routine of taking care of patients that we feel that this is the only purpose in our life. But how long are you going to take care of that? How long you're going to work on this? It's also very important to find a purpose, a meaningful purpose in life which is going to heal you. If it is draining you, it is not the purpose of your life. Finding the purpose of the life which gives meaning to your life, relaxing techniques, understanding the 4 ashramas of life. Now, in our Vedic studies, it's mentioned, the 4 ashramas are mentioned, the Balavastha, the Gruhastavastha, you know. So you have to understand these 4 ashramas and live according to the ashramas. Then periodic routine investigations. After you cross 40, it's very important that the developing diseases, because our body, it's a human body. Ultimately, we are the healers, but our body suffers too. So understanding the body needs and getting the periodic routine investigations done. Taking treatment if you're suffering from some health condition is also very important. Don't rely on ourselves that we'll take care of the treatment. If we know these medicines, we'll take it on our own. It's not the good thing. When we say that self-prescribing is harmful, when we say this to the patients, it also means that we are also patients and we need not self-prescribe ourselves. We need to take help from our colleagues or some other specialists who can take care of it.
Yes, madam. Just 3 minutes only. How
Yes,
many-
yes, sir. Over.
Oh.
So that's about it. Also, it is important that have a good insurance, okay, Mediclaim insurance. It's also important. Now coming to homeopathy, these are the remedies which I have found useful in treating the people who were suffering from burnout. Okay, Aurum Med, Argentum nitricum, Bryonia, Causticum, Colocin, Glonoin, Ignatia, Nux vomica, out of which, Ignatia, Nux vomica, Staphylococcus aureus were the medicines which I have frequently used. Like Lycopodium, opium, phosphorus, platina, pulsatilla, silicia, vanadium. So these are some of the medicines which I have used. So that's about the physician burnout and about healing thyself.
Yes, thank
I'm
you.
there. I'm there for the
Ye-
question and answers.
Yes, madam, it's really a great session. By all means, you have really covered almost all part of the same, because a physician, they heal themselves. That's what you meant, and how it can be covered. And even you mentioned about the homeopathic treatment. One more remedy I would like to add to that, that is cocculus.
Populous.
Yes, it's a burnout remedy, because you people used to, there are doctors who are sitting for a long time in night and then wake up early. We have a doctor here in Kerala who has consultation from the from 4 a.m. onwards, and he died by cardiac arrest in the toilet by about 3 a.m.
Yes.
morning. He was a person who was having a number of patients waiting in the queue at the time when he was there in the toilet and declared dead. So this is one area where every doctor need to look into, and every doctor need to care. This presentation really meant for doctors. All doctors shall watch it in the YouTube, those who missed the session. That's what I would like to mention about the presentation. Great presentation. I am inviting Dr. Ramparesh sir to say few words, as well as vote of thanks to the session, as time is already over.
Thank you, sir.
Yes, Ramparesh sir, please unmute yourself. Okay, doctor is not. Dr. Mariama John, you may please say vote of thanks.
Oh, अच्छा अच्छा
Yeah. Oh, yes, yes.
वंदना
Okay, okay. Okay, Ramparesh sir. Okay, you can say.
हेलो
Yes, sir, we can hear you.
हेलो
Yes, sir. Yes, we can hear you.
थैंक यू डॉक्टर धनेश जी एंड कॉन्ग्रेचुलेशन डॉक्टर राजेश्वरी रप्ता मैडम वेरी नाइस प्रेजेंटेशन एक्सलेंट सेशन
Thank you. Thank you.
very thanks and positive thinking doctor always positive thinking एक हिंदी में है एक हिंदी में भावना है सुभावना है हम हैं अमर निरोग हैं सर्वशक्तिमान हैं सुंदर युवा बलवान है, धनवान है, भगवान है।
सही है
अब
सर।
ज्ञान अपना हो गया, बस रोग दुख सब दूर है। हम रूप यौवन युक्त हैं, आनंद से भरपूर हैं। आनंद से हम हैं उछलते, रोग हम में है नहीं। हम है अमर, हम है जुआ, धन धान सब कुछ है। ये हिंदी का है। तो वेरी वेरी थैंक्स डॉक्टर मैडम, behalf of IFPH होल टीम, वेरी वेरी थैंक्स।
सर जाते जाते एक शब्द कहना चाहूंगी, because since our childhood, those people who are around my age, around 50s and 60s, who are in 50s and 60s, till then we have been since childhood our upbringing was a basis of spirituality. Okay, whatever religion we are, हम भगवत गीता पढ़ते हैं, रामायण पढ़ते हैं, ज्यादा धार्मिक भी है, उस बेसिस पे हमारा बचपन निकला है। तो ये सब चीजें जो है नई है, फिजिशियन बर्नआउट और ये सब चीजें, ये पहले हुआ नहीं करते थे, और हम ये सब आसानी से डील कर पाते थे। लेकिन अभी जो नई पीढ़ी आई है ना, तो इनके लिए ये सब करना बहुत मुश्किल हो रहा है। और आप शायद पता नहीं है आप लोगों को कि इन द रिसेंट न्यूज में जो आ रहे हैं ना, स्टूडेंट्स सुसाइड कर रहे हैं, डॉक्टर सुसाइड कर रहे हैं, हॉस्पिटल्स में वायलेंस हो रहा है, ये सब चीजें किस लिए हैं? बिकॉज द अपब्रिंगिंग एंड देन मेंटल कंडीशनिंग, द बिलीफ सिस्टम्स, ये सब ये होने के कारण है। तो इसलिए ये सब चीजें डिस्कस करना बहुत
Yes,
इम्पोर्टेंट है,
doctor, we can
और
discuss
इसीलिए दैट्स व्हाई वी आई पुट अप दिस टॉपिc, दैट्स द रीजन।
yes, very,
Thank you,
very good. Thank you, Dr. Ramprasad sir and Dr. Rajeshwari Rapta, and those who are in the session. Tomorrow we will have a session from Dr. Indrani Bhavatkar, and he will be talking about nephrology and homeopathy. This is what we would like to share at this juncture. All of you can join the session by using the same link that we shared for the tour. Thank you all. Good night. It's over to Dr. P. Shaila to moderate the Malayalam session.